Hi everyone, my name is Cami Navarro, and I'm a science writer here at the Asian Scientist magazine. Welcome to today's Wildtype Media Expert Opinion webinar, and a warm welcome to all of our friends over at Facebook Live. Today, I'm joined by Dr. Gia Sison. She is the head of the Women's Wellness Center in the Makati Medical Center in the Philippines. She is also the National Advisor of the Philippines Youth for Mental Health Coalition. Today, she'll be discussing COVID-19's emotional toll, exploring some coping strategies along the way. Before we begin, just a few house rules to ensure that we have a smooth flow. Firstly, all attendees are on listen-only mode. If you have any questions, please place them in the Q&A. It can be found at the bottom of your screen. Alternatively, you can also ask your questions live to Dr. Gia yourself by raising your hand virtually during the live Q&A round. Again, you should be able to see a raise hand option at the bottom of your screen. Last but not the least, just a gentle reminder that this webinar is being recorded and will be made available shortly after it ends. Now, please allow me to introduce our guest today. Dr. Gia Sison is an occupational medical specialist who rose to national prominence in the early 2000s for a frank discussion on her mental health struggles as a breast cancer patient and now survivor. As a result of her experience, Dr. Gia became a staunch mental health advocate. And in 2018, she helped lobby for the passage of the Philippines Mental Health Act. From one Filipino to another, welcome, Dr. Gia. It's our pleasure to have you here.
Hi, Cami, and thank you for inviting me to the Asian Scientist and to the Wildtype webinar series. I'm so happy to be with you.
All right, it's so nice to really have you here. To start off, Dr. Gia, I know that the Philippines has lifted some of its quarantine measures. Can I just quickly check up and ask how you are right now?
Not so well, but coping and thriving during these tough times.
Absolutely. So even though you're not feeling so well, that's the precise reason why we need this webinar today, right? So before we dive, yes, agree. Before we dive deeper into our discussion, I would like to know more about you guys in the audience today. So I will be launching a poll asking for your background. Where are you from? All right, so what do we see here? We have a lot of students. We also have some lecturers here and also medical professionals and also a significant amount of others. So in the chat, maybe you could tell us what these others are, right? So we can get to know more about you guys. So before we dive deep into the discussion, and I know that Dr. Gia would like to just set the context of our mental health discussion here today. So she has some slides that she'll be presenting. So Dr. Gia, I'll be turning it over to you.
Thank you, Cami. And allow me to talk about the mental health situation during the times of COVID. But let's set the tone that the first thing we need to understand is that mental health is not just about psychiatric conditions. They also include psychological, neurological, and substance abuse. And also, in terms of interpreting data, we have to understand that there are real limitations as we speak. So on the next slide, this chart is actually from Our World in Data, which reflects various data sourced from the Global Burden of Disease Study 2016, and it provides us a picture of the prevalence of mental health problems in a given population. So on this slide, it just shows that the highest rates are seen in Iran at 17.3% of the population, while the lowest is in Vietnam at 9.72%. On the next slide, we go closer on the ASEAN, and based from this data, most of the countries have a prevalence between 10 to 14% of the population. But we have to take into consideration that population growth should be factored into this study. And the next slide would show the picture of the Philippine mental health situation based on the data from WHO year 2017. So the numbers are there. We have 3.2 million estimate people diagnosed with depression, 3 million with anxiety. In terms of financing, it's at 2.67% only of the budget allotted. And to your right, that's the actual mental health situation in the Philippines. So on the next slide, it actually shows that much is still has yet to be done in terms of mental health in the Philippine context. And it has to align with the four transformation shifts in the global mental health uh, as published in the Lancet report, as the bullet points here. So the nature of the mental health disorders and intervention is important. It's um, it's better to adopt a holistic approach. Then there is the shift from institutional to community care based, moving from a treatment focus to prevention and promotion of mental well-being, and a more liberal take on who the provider is. And lastly, I think one of the most important is harnessing the power of service users. This is where patients get empowered to talk about their illness and suggest ways in how they think it can improve. So take it away, Cami.
All right. Thanks so much for giving that context, Dr. Gia. No less than the United Nations has warned us that COVID-19 could spark a global mental health crisis. Why do you think COVID-19 is taking such a huge toll on our mental health?
Okay, so first of all, a pandemic is a stressor in itself, and it poses risk both short term and long term. But as we speak, we do not have data yet on the studies of the effect of COVID with mental health, but it's ongoing. We also need to understand that mental health problems that we face are not actually new, and the numbers are actually existing even before the pandemic has happened. And there's also this factor that those who have coped before may not be coping as effectively now with the multiple stressors that we are all experiencing. And I'm not just talking about mental health as a state of anxiety. There is also that financial aspect, economic aspect. So many people have lost their jobs and are living on a day-to-day basis. So that in itself is something that we are worried about.
I see, Dr. Gia. So beyond just a quick question, aside from the
Mhm.
financial and economic stressors you were talking about, are there any other stressors that we should be aware of?
Yes, there's that fear of having the disease. That's number one. And for the frontliners, there's this fear of bringing the disease home to their families. There's a large part of uncertainty in terms of livelihoods and their future. Um, COVID-19 is a lonely disease, so there is social isolation, which may lead to deeper feelings of loneliness. There is also an increased incidence of domestic abuse and violence because everyone is at home. Uh, the perpetrators get a chance to attack and so forth. Exposure on negative images on media is also there, and it may lead to negative coping mechanisms such as increase in tobacco use, drugs, which we don't want to happen.
Absolutely. So thank you so much for laying all of those out very clearly. So now that we know why or the reasons behind COVID-19's startling effect on our mental health, could you now explain to us the who, which groups stand to be most affected by the pandemic's psychological impacts?
So first, again, there's no data yet comparing the psychological impacts of COVID-19 to various groups, but the following are people which we should be concerned about. So number one are the frontliners. Why? Because as a doctor myself, we are faced with patients who are fighting for their lives, patients who are uncertain about their condition. In fact, in the People's Republic of China, healthcare workers reported high rates of depression at 50%, anxiety at 45%, insomnia 34%, and that's based on the study by Lai et al. 2020 as cited in the UN. Older adults are also prone to mental health conditions because of the isolation and comorbidities, because there is also a factor of lack or inaccessible medical services that are non-COVID related. So take, for example, a patient who needs dialysis. They cannot really just go to a center just to have just to get a dialysis like before. So there is a process, and that in itself is stressful. Then we have the adolescents and young people who are again prone to domestic abuse, and uh, there's an impact on their future because academic school years have been moved. Social connections have been disturbed due to suspension of classes. Dreams may have been postponed. Board exams have been moved as well. And also women, because some women have to balance between work and household responsibilities as well. So domestic violence in this context is real. So these are the, actually, well, for me, these are the top four most vulnerable during this pandemic.
I see. So for any of you guys in the audience who do fall under these high-risk groups, according to Dr. Gia, I hope that this webinar will prove useful for you. And if you have any insights of your own, do take the time to share it with us in the chat and also the Q&A. Now, for the rest of our viewers, I want to check up on you guys as well. How are you? Has COVID-19 impacted you psychologically or mentally in any way? So this is going to be just a short mental health check. So have you been extremely affected? Have you been slightly affected? Are you one of those lucky few who hasn't been affected at all? Then please give us some insight. This could be actually, very insightful for Dr. Gia. So we see that a significant number of our audience is moderately affected. We also see that the next one is slightly affected, but there are also some who are extremely affected. So Dr. Gia, what do you think of these results?
We have to realize that negative feelings are expected during these times of a great major stressor like COVID-19. In the first place, it hit us by surprise. As far as I recall, before the lockdown, we were still doing normal things. But after March 15, things started to change. And these abrupt changes may actually lead to short-term and long-term mental health conditions. That's why some reactions to psychological distress are really varied. On the poll that you conducted, some are moderately affected. So this is something that is subjective. But one thing is for sure, negative feelings are really expected out of this. Like, and it's okay to acknowledge them because they're real, and we have to realize that we are all experiencing our own personal stressor in the time of COVID.
Absolutely. So now that we all know that some of us have been emotionally affected by the pandemic, I just wanted to ask you, Dr. Gia, for the benefit of everyone in the audience, what are some clinical manifestations of psychological distress caused by COVID-19?
Okay, so let's start with the physical manifestations. A lot have been reaching out because they have problems in terms of sleep. Sleeping patterns have been affected. Eating patterns have been affected. And we have this term called cabin fever, where you feel that you are locked up inside a room where You can't even describe how you feel. So those are the common there are there's hyper or extra sensitive. You get easily agitated. um, Feelings of isolations are there. Feeling anger is part of it because you don't even know what to expect the next day. So these are varied emotions that we are encountering every day of our lives.
I see. So for everyone in the audience, these are the signs that we should look out for, not just in ourselves, but also in our loved ones, in our friends, and in our family. On that note, Dr. Gia, I know you mentioned earlier something about how frontline healthcare workers are some of the most high risk at at feeling these psychological distress from
Yes,
COVID-19. So
yes.
we've seen recent reports that across Asia, frontline healthcare workers and COVID-19 patients have been facing social stigma. So, how can this stigma be managed and addressed?
Okay, there was the American Psychological Association listed out a number of tips that can actually help in addressing the stigma. Number one, you have to educate the people with facts. It's really hard, evidence based facts about COVID 19, because at the end of the day, facts minimize fear, and it also gives people a sense of confidence, quote unquote. So if you hear some of the myths, rumors, please speak up and correct it accordingly. Also, now's the time to engage social influencers who can be powerful voices in combating stigma and engaging people in preventing discrimination. In fact, some cities in the Philippines already have adopted local ordinances to prevent discrimination. In fact, there's a hotline that one can call if he or she feels that he or she has been discriminated. And I have heard a lot of stories about frontliners being kicked out of their places because of fear of having the tenants get the infection. And that for me is unacceptable.
I completely agree. So, Dr. Gia, we know that it's not just the COVID-19 patients and the frontline healthcare workers who are feeling psychological distress, right? So, we're all being impacted by this pandemic in different ways. So, for companies in particular, there's been a sudden shift to remote work. So, I myself, I've been working from home for the past 2 months now. It's my first time to be here in this office for 2 months. Okay, so
Right.
I'm very thrilled to be where I am right now. But the thing is, remote working is likely here to stay. So, for employers, what are some concrete steps that they can take to ensure that the mental well being of their employees will be fine in this new normal that we're all facing?
Okay, from an occupational medicine standpoint, since that's my specialty, it's very important for employers to communicate clearly to their employees what path the company is taking. Because the least that the employees need is uncertainty. Because we're already facing something that is uncertain. And it's another thing for our employees to be even uncertain about where they are, how they're gonna earn, is it gonna go on? So clarity via dialogue with the employees is very important. Number two, it's also important to assure the employees that they're safe, that there are alternatives that they can take aside from physically reporting at work, which is why remote working is still advised even during the general community quarantine. Even if it's lifted, it's still advised. And of course, we have to also assure that the promote a network of support in terms of mental health. That is also one help. And of course, the basic needs, like if the employee needs transportation to work, it will be a big help if the employer provides for those needs, because those are the basic needs that must be met.
All right. I see. So to all of the employers in the audience right now, I do hope that you took note of everything that Dr. Gia said. So please communicate, please engage in dialogue with your employees, assure them that they are safe, give them alternatives, and make sure that their basic needs are met. Did I miss anything, Dr. Gia?
Perfect, Cami. And
All right.
yeah, and just to add, I know it's quite costly, but in the tiering of occupational health safety standards, engineering controls is also important. So this is where structural changes can be applied. So again, it's really all about restructuring the workforce and the workplace at the same time through constant communication and engagement of the employees and the employers.
All right. So again, thanks. So all of the employers and audience, please, I hope you're taking notes. Now moving on to a much larger scale,
Mhm.
you were a prominent lobbyist for the passage of the Philippines mental health law. What do you think governments can do to tackle the impending mental health crisis that could be caused by COVID-19?
For one, it will be very helpful to integrate mental health interventions in the pandemic response with specific services to address the needs of people in various stages in the mental health illness spectrum and those populations at risk, which I have mentioned earlier. Number two, work with civil society organizations, and it has to complement the government programs also for mental health. Number three, make sure that social welfare services are also given efficiently so that the basic needs are met. And number four, make sure that government is also transparent and it pays to be able to adopt an empathic and clear communication workflow or process flow to be able to decrease at least public anxiety. And it's also quite, we can also note that you may want to shift the narrative from reporting deaths to recoveries because we are holding on to those little glimmers of hope stories that we listen to. Of course, it's okay to report it as is, but for me, hyping on the hope and the recovery part is very, very important in easing the already existing public anxiety because of COVID.
Absolutely. I really agree with that last point. You know, at this point, I've actually stopped looking at the number of cases because it just gives me, it just gives me like an anxiety attack. So I agree that there has to be that shift to maybe reporting some more hopeful news, hopeful but accurate news, of course, right? So any
That's
government
right.
officials or employees in the audience, again, take note. Now, before we open up the floor to the Q&A, and I can see that there's a lot of very interesting questions that we can get to. I have one last question, and this is for the benefit of our audience and also maybe asking for myself. What are some ways that we can look after our own mental health during this time? So, Dr. Gia, I know you went through some experiences during your time as a breast cancer patient. So maybe you have some insights and strategies that could prove useful for the rest of us.
I remember my journey before. It was really similar to this because I had to undergo quarantine during chemotherapy since being exposed to the public can compromise my immunity. So one tip that I can give is maintain your social connections. We are advocating for physical distancing, not social distancing. So maintain those social connections with loved ones, with friends, with family. Also, it pays to practice to in terms of feelings, to express, to listen, and to reassure. I know it sounds so heroic, but it would really help a lot in terms of easing um, anxiety. Take care of yourself also in terms of physical health. It was very underrated. It's quite an irony that we have taken for granted hand hygiene for so long. But what is the number one practice that we should do now to prevent COVID. It's hand washing. So my point is, don't forget to also take physically care of yourself, which means physical activity, the right amount of sleep, uh, right amount of nutrition, building up on immunity matters. And of course, limit exposing overexposure to media that distresses you. So you have to learn your limits in terms of where you get your news. Just ensure that you get it from valid sources. So a typical practice is you may want to just choose one agency that you listen to in the morning, then get on with your day and end with something that will update you on what's happening as well. So those are some ways that one can take on. These are just tips. Of course, I acknowledge that all of us are different. We have different ways of coping, and we vary in a lot of ways.
Absolutely. Thank you so much for giving those different tips, Dr. Gia. I think they're widely applicable for the most part. But yeah, so everyone, please take notes. And now we have time for the Q&A. So we have a lot of pretty interesting questions. There's this one by Mr. Donovan Fu that I find very interesting. So Mr. Donovan Fu, if you're there, I would like to give you speaking privileges just so you can ask Dr. Gia yourself your very interesting question. All right. Can you please give your affiliation and ask your question briefly? Thank you.
Hi, my name is Donovan. I'm actually in the marketing sector, so thank goodness work hasn't stopped, but at the same time, it's really stressful and it's very different kind of working from home. So my question really is, how can we as individuals or maybe as communities convince organizations and governments to take mental health seriously? Because it seems like Philippines isn't the only one country, right, that's kind of underfunded when it comes to mental health, and at the same time, raise awareness about the importance of mental health.
From the time that we have lobbied, thank you, Don, for the question. Just my take on this. Well, from the time we were lobbying for the Mental Health Act to become the mental health law, a big factor on that is to be able to speak up on your needs. So I have to say that there has been an improvement in terms of the acknowledgement of mental health as a need, but there is also a need for workers to speak up on what they want. This is where dialogue comes in terms of the workplace. So if you need something, it's nice that you are able to dialogue with your employer and start from within, hoping that that will have a ripple effect outside, and that that will lead to a program to address mental health wellness.
All right, so thanks for answering that question, Dr. Gia. We have another question. I think it's related. So if you have anything to add, I guess, it's from Jeline Key. And she's asking, how do we encourage constructive and meaningful conversations surrounding mental health in today's society?
Okay, that I would want to relate that to the stigma that is always with mental health. There are a lot of cases actually stigma can be best addressed when we openly speak about mental health. I think it's about time that we start talking about mental health on open doors. It's not something that we keep. So the more we talk about it, the more the stigma is busted. The more myths are addressed, the more it is, again, the more it will be of help to the question. So talking about it for me is a big factor in being addressing the stigma.
Could you share with us, Dr. Gia, how you talk about it? Like, what outlets do you use to raise more awareness about mental health?
I use my social media platforms in being able to tell my story. So narratives are very important. This is what I was mentioning earlier, that patient voices matter. Talking about my experience, if and when you're ready. I'm not saying that it's mandatory that you share, but it highly helps in being able to talk about how you felt, the journey that you underwent, and of course, the realistic hope at the end of it. So that's how I always tell my story.
I see. Yes. Just sharing. So that's how I know Dr. Gia. I was able to hear her story live before in one of the conference we were previously at, and I can really attest to the power of narrative in shaping these stories about mental health. So there's another question that I find very interesting. It's from Mayen Pineda. And Mayen, I would like to give you audio privileges so you can ask it yourself. Okay.
Hi, can you hear me?
Yep.
Hi. So Dr. Gia, my question is more of, you mentioned earlier that financial issues are a huge problem, especially in the Philippine context, as a stressor towards someone's mental health. Are there programs now to make mental health care more accessible to people who could otherwise not afford it, especially during this quarantine?
Okay, during this quarantine, there are a lot of platforms that you can already access in terms of telehealth services. So this would include online counseling for free. So they have our National Center for Mental Health has opened several lines just for you to be able to reach out. And it's also worthy to mention that some organizations have taken the effort in taking care of the logistics part in for those for those patients in need of medication and because there's a service disruption. So um, particularly PhilHealth is now studying packages that can address mental health as well. So hotlines can help because they are actually support systems. So you can call it anytime, 24/7. Mayan, I hope I answered your question.
All right. So there's another interesting question actually here, and it's from Jesus or Jesus Peralta. Sorry if I pronounced your name wrong, but he says that he's an OSH practitioner in a multinational company. So would like to ask, what would you advise us to do to address the stress and fears of other workers when one of their employees is diagnosed positive with COVID-19? So I think that's a very real situation that a lot of
Yes.
companies maybe are facing. So what can you say about that, Dr. Gia?
Okay, so he's a fellow occupational medicine practitioner like me. So we have formed actually a workplace algorithm of how to practice work and safety during COVID-19. So it helps if you have a communication plan in the workplace where the worker can actually seek help both medically and mentally. Because again, I'd like to emphasize that COVID isn't just about the physical aspect, it has a mental health aspect as well. Assuring the employees that the company will be able to support his or her basic needs is very, very important. And also, it's worthy to mention that companies might want to take on the idea of being able to train their HR practitioners with mental health first aid. So just in case you don't have to be a doctor to undergo that training, because it can help at least address basic issues or the issues that employees feel, like the anxiety that Jesus has mentioned.
I see.
I hope it helped.
You know, Dr. Gia, I actually didn't know there was such a thing as a mental health first aid. So thank you for introducing that concept. I learned something new today. So we have another really interesting question, and it's from Jello Dionora. So Jello, if you're there, I'd like to give you the opportunity to ask the question to Dr. Gia yourself. So please introduce yourself, give your affiliation, then you can ask your question.
Hi, can you guys hear me?
Yep.
All right. Hi, Dr. Jaya. Hi, Cami. I'm Jella Dinora. I am a PR manager and also a writer for different publications. I'm actually writing right now a piece on mental health and wellness in the workplace. And the discussion has been fruitful, but there's also one point I wanted to ask about intergenerational differences and
Mhm.
perspectives on mental health, especially right now when tensions are high and people might understand mental health quite differently when we're looking at it from different age perspectives. And companies sometimes have that structure. You have young talents being nurtured by the wisdom of their veterans. How do we facilitate that proper conversation and that seamless conversations about mental health with those kind of teams in the workplace?
So you're talking about more of it's a cultural issue, if I'm not mistaken, Jella, am I right?
Yes.
Okay, so we have that's a very well, it's very valid that we are there is an intergenerational gap when it comes to the understanding of mental health. But on the other hand, it shouldn't stop us from uh, s- being able to speak up, or you might want to start a mental health session to align them on the definition of mental health. Again, mental health isn't all about when you talk about mental health, you also have to practice it. So, with the advocacy of being able to talk about it in small groups and making them understand and acting on it, I think that's a very important move to be able to make another culture, so to speak, understand that mental health wellness is really a need that we need to address.
All right. So there's speaking of culture, there's this other question in the Q&A, which is, I guess, related. So it's from Patricia Sim, and I think just touching, maybe moving on from her question, is there any difference in how we approach mental health from the Asian perspective as opposed to, those in the Western world? How can we, have a uniquely, let's say, Asian approach to dealing with mental health fallout from COVID-19?
Um, that's a very difficult question, but um, it's I believe it's not really it's more of really speaking up and being open about it. I think in the Philippines, stigma is still there, but I guess it's really a worldwide problem that we need to address all together and aligned as a whole. So, um, well, on my experience, they're more open in the Western world, but we're beginning to open up in terms of in the Asian countries as well.
Okay, that's great. Yeah, I do see a lot of in Twitter, especially. I do see that there's been a lot of conversation now on mental health.
Yeah.
So there's this other question, and it's from a student. So a lot of students have had their studies disrupted. I mean, my friends in med school, for example, like you said, they've had their board exams postponed or otherwise disrupted. So how can universities strike the balance between um, supporting the mental health of their students while also, I guess, ensuring quality education? Would you be able to give some perspectives on that?
Okay, from a mom's perspective, from a mother's perspective, I think the schools have to begin exploring how alternative ways of being able to deliver education. Um, it may be different from the physical physical teaching, but again, I live by the mantra of making do with what you have. So schools have to open up and I think it's make it more accommodating also for students because let's face it, not all students have good access to internet. So that's one. So they have to factor in that consideration also in terms of being able to blend online learning and offline, so to speak, learning. So start from there and be flexible with deadlines as well because we're working under extremely hard times. So it will be highly helpful if you can flex the grading system, accommodations, etc. So that's my take, and that's how I see it. It's a proactive move, but it's much needed.
Right. I think I am beginning to see some of those approaches, not just in the Philippines, but also in universities worldwide. Now, I guess just one last question, and it's from Annalisa Kiat. So, how can, I think, and this is related to your previous answers from before. So, for the frontliners especially, what can we do to protect them, Dr. Gia, from the mental health onslaught that many of them and the stigma that many of them are facing?
Be part of the solution of being able to bust the myths that frontliners are well, everyone can be a carrier. That's for one. Um, Follow the guidelines, the strict health guidelines, because um, staying at home can help. Support groups matter also. So if there are listeners who are keen on being able to give frontliners support, we need it in terms of a support group that really addresses our needs. And of course, this is where family comes in. Proactively also involve yourself in these types of conversations. So, and I'm not talking about just frontliners as doctors, nurses. I'm also talking about the other frontliners who are out there serving despite the pandemic. So, um, basic needs should also be met. So again, it's not always about how they feel. It's also a balance of what they need as well. So find that balance in between, and that can be a starting point for frontliner support.
All right. So, Dr. Gia, I just wanted to give you, maybe you have like one last, let's say, call to action, since mental health really is something you're passionate about, right? Do you have anything, any last words, famous last words to share with us today?
So number one, COVID-19 is not a death sentence. Um, Social distancing doesn't mean wait, physical distancing doesn't mean social distancing. Keep those ties connected, and at the same time, uh, be an advocate of practices that would promote prevention and support in this tough times called COVID-19.
So thank you for that, Dr. Gia. And I can see that we have many more questions, but unfortunately, we don't have all the time in the world to answer them. Thank you all for your very active participation. We have an exciting lineup of speakers waiting ahead. So next week, June 3, that's a Wednesday, we have none other than Wikipedia founder, Jimmy Wales. You heard me, Wikipedia founder. I'm sure for all the students in the audience, and I guess everyone, we've all used Wikipedia in one way or another. So he will be joining our CEO, Dr. Juliana Chan, for a conversation on fighting fake news during COVID. Isn't that a very relevant webinar? So there should be a link in the chat right now to his registration page. For full listing of our upcoming webinars, do check out asianscientist.com/events. Again, that's asianscientist.com/events. Finally, I'd like to take this time to thank you, Dr. Gia, once again for answering our questions today. Mental health is often an overlooked topic, but I think for 45 minutes, we were able to push it to the forefront.
Thank you, Cami, and thank you to the Asian Scientist team, and to all our viewers and listeners. Thank you so much.
So with that, good night from Singapore. I hope you all apply the mental health tips and tricks that Dr. Gia has shared. I hope you all learned a lot in the first place. Please wash your hands. Please wear a mask, please. Stay safe, stay healthy, and thank you for joining me today. Signing off.